Hello everyone, this is Dr. Tarun. I'm consultant physiotherapist at PIMS. Today I'm talking about how a sternoclavicular joint and acromioclavicular joint will affect your glenohumeral rhythm and glenohumeral motions. First, sternoclavicular joint. So as we know, our sternoclavicular joint has 3 degrees of freedom. That is, it has 3 rotatory movements and 3 translatory movements, which are elevation, depression, posterior rotation, anterior rotation, and protrusion and retraction. And our acromioclavicular joint has 3 degrees of freedom again. It has 3 rotatory movements and 3 translatory movements, which are anterior rotation, posterior rotation, upward rotation, downward rotation, and the last one is internal rotation and external rotation. Remember, in internal rotation and external rotation for acromioclavicular joint, your reference point is glenoid cavity. If glenoid cavity coming forward, then it is internal rotation, and if glenoid cavity moving backward, then it is external rotation. Now we will mobilize the SC joint as well as AC joint to correct glenohumeral rhythm as well as our motions of glenohumeral joint. So for sternoclavicular joint, the patient position will be sitting and the therapist position will be side to the patient. Now you have to put your thenar eminence over the sternoclavicular joint. First you have to palpate the sternoclavicular joint and put your thenar eminence over the sternoclavicular joint, and by imposing second hand you have to give the glide inferiorly. So for count of 6, 1, 2, 3, 4, 5, 6. Here we done with the sternoclavicular joint mobilization. For acromioclavicular joint, the patient position will remain same, the therapist position will remain same. You have to put your hypothenar eminence over the lateral end of the clavicle, and by superimposing from the second end, you have to push the lateral end of clavicle downward or inferiorly. You have to give the glide comfortably. As we know, sternoclavicular joint and acromioclavicular joint will have huge impact on your glenohumeral rhythm as well as your glenohumeral joints.